This is an important topic, and we're excited to be bringing together members of the housing community, including advocates, developers, housing planners, and others, to learn how to better consider health in decisions that are made around housing. This webinar is just one component of an exciting collaboration between the National Housing Conference, the National Center for Healthy Housing, and the Health Impact Project. For the past 18 months, we've been working together to develop guidance and tools to help facilitate the use of health impact assessments in housing decisions, and you'll get to hear about some of these resources during the webinar. Today, you'll also have the opportunity to learn about HIAs, what they are, how they can add value to housing decisions, and then to hear 3 exciting case studies about how HIAs have been applied to housing decisions, and then how you can get started to use an HIA as a tool in your work. So I'm going to introduce the speakers in just a minute, but before we get started, just wanted to cover some of our most frequently asked questions on the webinar. The first one is this being recorded, and the answer is yes. An archived copy of this webinar along with the PowerPoint will be made available to anyone who's registered for the webinar. We'll send out a link once the recording is online, and our goal is to provide these resources within 48 hours of the webinar. Second, you'll please note that all of the participant lines are muted in order to ensure clear sound quality for everyone. But we do want your questions, and we'll be taking questions at the end of the presentation. So as you have questions, please submit them through the question box in the GoToWebinar control panel. We'll be monitoring the questions throughout the webinar, and we will make every effort to get to as many as possible within our time after we've heard from our speakers. Finally, if you run into any technical difficulties during the webinar, which we hope you don't, but if you do, please use the help menu at the top of the GoToWebinar control panel to locate technical support. We also invite you to type a note into the question box if you're running into technical difficulties, particularly around audio. But we may not be able to help address the technical problem on our end, so it's a good idea to visit GoToWebinar's technical support site. Okay, so with that information, I'd like to introduce briefly our speakers. We have Jill Bricey and Jonathan Wilson of the National Center for Healthy Housing. We'll hear from Ruth Lindberg of the Health Impact Project. We'll hear from Holly Holston of the Ohio Housing Finance Agency, from Megan Weir of the San Francisco Department of Public Health, and from Shana Burkett from the Denver Housing Agency. So with that, I will turn it over to Jonathan Wilson from the National Center for Healthy Housing.
Thank you, Lisa. I'm very excited to be with you all today. We've been working with the Health Impact Project for over a year now on a document that will be coming out sometime later this year on incorporating health into housing decisions and talking about the opportunities for health impact assessments in housing work. So the purpose of this webinar, and for my portion of it, is to set the stage. I come to this with a housing background, a housing policy background, and for those of you who have been working in this space for a while, you recognize that over 15 years ago, the health and housing connection wasn't that clear. And that when we would go and talk to people in the health space, there was often, blank looks about what we were doing and the opposite way around. And so there's been great growth and opportunity within the last 15 years in this space. We now hear people talking about housing as a platform. We hear about people talking about health in all policies. The organizations and groups that are working in this space are coming together, and the healthcare reforms have definitely been an opportunity for all of us. So I know that many of you who are working in the housing space have already been starting to make these connections. And so I don't want to spend a lot of time on giving a lot of background on it, but just to give you a quick overview, especially of those of you who maybe are coming to this new and really need a quick refresher on how health and housing are really working together. So looking at that, we know that housing matters to health. Over the last 15 years, research has consistently demonstrated the link between housing and health. We know that housing quality, affordability, location, and the community neighborhood interactions all have an impact on both the residents' physical health and their mental health. And you can see from this slide how that it's just a cluster of many things going on, that each of these activities, whether it's quality, location, community, or affordability, have different ways of interacting, so they affect both the residents' physical health or their mental health, and then the mental health affects their physical health. For those of you who have been in housing for a while, you often think about the housing quality as that key indicator, what's really going on. We have the legacy issues within housing. We know about lead and asbestos and how they affect people's health. But we also know about these new factors that are coming into health. Just last month, 60 Minutes talked about formaldehyde and how that's having an impact on people's health when not properly controlled and properly regulated. But beyond those housing quality issues that have an impact on cancer, injury, cardiovascular disease, we have other things going on in the home, like lighting, like noise. Some of you may have just heard the fire truck in our background. There's physical comfort, and we know that those have an impact on our day-to-day living and how well we live, and some of those actually have an impact on physical health. They've shown that there is actually a linkage between cardiovascular disease and your comfort. But all of these put together have a big impact, and so we do a lot around making sure that people are living in the highest quality housing and that they have a good quality place to live. But beyond that, there are other factors. Location makes a big impact. There's been a lot of movement in the last 10 years around healthy communities and whether people have access to proper health care, whether they have proper public transportation, regular transportation. Walkability is an important issue. Whether they're living in a food desert or whether they have access to good quality food in their community, whether they have their marketplaces that they can go to and get fresh vegetables and fruits. Of course, there's issues around whether they can get to jobs. And, of course, there's pollutants outside of the home, whether they live near a brownfield, whether they're near a bus stop that's spewing out diesel fumes, whether they have blight in their community that makes it unsafe for them to walk around their community, whether there's just general crime issues, and, of course, whether there's traffic. It's one thing to have public transit and walkability, but if there's high-speed roads that are around you to get to that bus stop, then it's not a real walkable community. So all those factors need to be considered when we're citing a location, when we're thinking about what we should be doing about our affordable housing. And when we talk about affordability, we recognize that affordability has an impact on health, that it's not only about adequate shelter, but whether people are having to make trade-offs on where they live and the other needs in their house, in their home life. Whether they can pay for utilities, whether they can pay for food, whether they have enough money to pay for the medicines they need to live their daily life. All these are connected with housing security versus evictions, home ownership versus foreclosures, and proper access to adequate shelter versus overcrowding. All these activities tie into the health of the residents and their families. And finally, we have community. And we don't have a great way of living if we don't have those social interactions that make life full and rich. And so we need to have social networks within the community. We need to have those ties. We need to be able to feel like we can have a faith-based set of living, and we don't want to divide up neighborhoods so that we move people to places so they don't see those same ties. we need to make people feel like they have social interaction and they have political power and political will to work. We know that in education, having strong PTAs are important to having a strong educational system. All those things require strong communities where people feel like they can connect with their neighbors and move forward. So as we look to this, we recognize that all these factors come in and should be recognized in a health impact assessment. But beyond that, there's just basic knowledge that the research has shown that our housing has an impact on our health care costs, and by improving our housing, it can reduce our health care costs. In the past year and a half, we've seen reports come out about a work in San Francisco and a comparison of public housing versus redeveloped Hope 6 housing, showing that emergency department visits declined by more than 39%, saving $2,000 for children. We've seen other reports talking about when we braid weatherization and lead house control, and when we do proper health education, that we're seeing fewer emergency department visits, fewer hospitalizations, fewer missed work and school days. All of these are contributing to a healthier environment for our children and for our households. In addition, there have been studies on homelessness and supportive housing and how when we provide better supportive housing and move people from the streets into permanent residencies, we are showing real savings in healthcare costs, especially those frequent flyers that are on the streets and going into the emergency department on a bi-monthly basis. We're seeing ranges of savings from $16,000 to almost $60,000 a year. Now, these savings are when we have supportive services that are matched with homelessness, but when we can bundle these services together, we're showing a clear benefit to society as well as to the individuals who are served. So with that quick background, I want to talk about or share the presentation with Ruth Lindberg, who will be talking about health impact assessments. HIAs are being used more and more often to help housing and community development professionals consider health implications when making decisions. They broadly consider environmental, social, and economic factors related to health and evaluate the potential impacts of proposed action on health and well-being in the community. Ruth is the Senior Associate at the Health Impact Project, and she'll discuss what HIAs are and where they're being utilized in the United States.
Thanks so much, Jonathan. Good afternoon, everyone. I'm really excited to be here today with you. I think that we see housing and community development professionals as being a really key partner in improving health outcomes for families across our country. So thank you for the important work that you do for people's homes and people's communities. For those that may not be familiar with the Health Impact Project, we are a collaboration between the Robert Wood Johnson Foundation and the Pew Charitable Trust based here in Washington, D.C. And we are a national initiative that works to promote and improve health by supporting the use of health impact assessments, or HIAs, as you'll hear us refer to them, as a decision-making tool. And we do this by funding HIAs at state and local levels, building and strengthening training and technical assistance to support HIA practitioners, and conducting HIAs on federal level decisions. So as Jonathan described, the research has shown clearly that social and economic factors and our physical environment, including our housing and our neighborhoods, are key drivers of our health outcomes. However, we know that public health professionals are often not involved in decisions related to housing quality and affordability, employment, and other things that impact our health. And sometimes on the housing side, housing and community development folks don't have the public health training to be able to bring health considerations into their work on a day-to-day basis. But we believe that factoring health into decision-making in sectors like housing and community development will be critical to improving health and lowering healthcare costs, as Jonathan mentioned. And so health impact assessment is a tool that can help us to minimize health risks and maximize health benefits when we are making decisions about housing policies, programs, and projects. So I'll spend a few minutes today talking about health impact assessment and just giving you a background. Some folks may be familiar, but we want to make sure that everyone is coming to the webinar with a common base of understanding. So we'll set the stage and give you a bit of information about HIA and then tell you where you can learn more if you'd like more detail after the webinar concludes today. HIA is a structured but flexible process that helps to predict the anticipated health outcomes of a decision before it happens. HIAs gather information and make predictions about how a proposed policy or program or project might affect the health and well-being of the community. So another way to say this is that HIAs help communities and decision makers look both ways before they cross the street. So in other words, before we make decisions, we should sort of take a look down the road and think about what health impacts might be there, and then think about how we can promote and enhance the positive ones and mitigate any negative ones. HIAs use a variety of different data sources, including qualitative and quantitative analysis, as well as input from a range of stakeholders to identify health concerns related to the proposed decision. Equity is a core value of HIA, and so HIAs also identify how these health impacts will be distributed among the population. So thinking particularly about how it might affect the health of vulnerable groups such as seniors, children, and low-income families. HIAs offer timely, practical, and useful recommendations that policymakers can implement to protect and promote health. So thinking about feasible recommendations that can be implemented to address health consequences and maximize health benefits. So I won't spend a lot of time today talking about the HIA process, but I did want to touch briefly upon the 6 steps of the HIA process, and then we'll provide you some resources at the end if you want to learn more. So the first step is screening, and this is where you determine whether or not an HIA will add value to the decision-making process and whether it can be accomplished in a timely manner. So HIA is not right for every decision. There are many factors that you want to consider when determining whether or not to conduct an HIA, including whether or not the HIA will add new information, whether you have the necessary resources and capacity to do the HIA, and whether or not your timeline and the decision-making timeline allows for the HIA to be completed in a way that informs the decision. The scoping step helps you to identify the populations that might be affected by the decision and to narrow the scope of the health effects that you will assess. As with any form of research or assessment, you likely won't have the time or the resources to examine everything, and so scoping helps you select those priority issues for analysis. Assessment results in 2 outputs. The first is a description of the baseline health conditions of the potentially affected populations, and the second is an impact assessment that describes the predicted health effects that the decision will have. In the recommendation step, you develop evidence-based recommendations that will mitigate any anticipated negative impacts and maximize the benefits of the proposed policy, program, or project. Again, it is important to ensure that your recommendations are practical and feasible. In the reporting step, you document the HIA's process, the findings and the recommendations, and communicate these findings to stakeholders, often through a written report and through other venues as well. Finally, in the monitoring and evaluation step, you determine the effectiveness of the HIA process. You track the impacts of the HIA on the decision-making process and the final decision, what was implemented and put into place, and then track the effects of the implemented decision on health. So a critical thing to note here, too, as you can see on the left side of the screen, is that stakeholder engagement is a core component of HIA work. And so at its core, HIA is a framework that brings together different stakeholder groups, and these include community members that might be affected by a decision, community-based organizations, decision makers, industry, developers, nonprofits, public health professionals, and others to collaborate to proactively consider the health implications of a particular decision. And HIAs can provide a neutral framework to convene stakeholders with different interests. This map shows the distribution of the HIAs that have been completed or are in progress across the United States. And this map from August of 2014 shows nearly 320 HIAs completed or in progress across 37 states at the federal level, in Washington, D.C., and in Puerto Rico. This map reflects the tremendous growth in the field in the last couple of years, with a growth ratio of over 800% from 2007 to 2014. And we're constantly updating this map, and the most recent numbers that are not yet reflected here show nearly 350 that have been completed or are in progress. So this is a rapidly growing field, and we're excited to be a part of that. This chart shows how HIA has been applied to decisions at different levels. Just over half of the HIAs in the United States have been conducted on local decisions, followed by state, county, and then regional and federal level decisions. And here's the breakdown of the types of organizations who lead the work on HIAs. As you can see, government agencies have done the most HIAs in the U.S. And have been the lead agency on those. But there's a diverse range of entities that conduct HIAs, and these include nonprofit organizations, local and state government agencies, as I mentioned, which often are public health agencies, transportation, housing, or planning agencies, as well as universities and research institutions and other partners. As you will hear in more detail as the webinar goes on, in recent years, housing professionals, including state housing finance agencies, public housing authorities, and community development organizations, have been gaining HIA capacity, and in some cases are leading HIAs in their communities, and you'll see examples of those later today. HIAs have been conducted on a wide array of topics and decision types, including decisions about the built environment, transportation, natural resources and energy, agriculture and food policy, housing, labor and employment, and education. And as you can see on this slide, a majority of HIAs have focused on the built environment and transportation decisions. And some of these have also included a housing element, and Jonathan will talk a bit about those in a moment. Housing HIAs specifically have covered a wide range of topics, including housing affordability, zoning decisions, energy assistance programs, and housing inspections. And many of these have focused on specific housing features like home energy delivery systems or programs and policies that directly affect housing, like rental voucher programs, housing inspections, or building codes. Several opportunities exist to increase the use of HIA in housing decisions, and we're excited to hear about that more today. So I'm going to turn it back to Jonathan to give us a little more background on the housing HIAs conducted to date and to begin identifying some of these opportunities for increasing HIA's use in the housing sector.
Great, thank you, Ruth. So this is giving you a preview of the document that will be coming out later this year. So the document will start off with a background on the existing housing HIAs as of up to 2013. At that point, there are 40 HIAs. Most of them were actually in the community development field, but with a strong housing component. So there was at least an element of where should we be siting a house, or what's the impact of a zoning change that will affect residential housing. In addition, there were 11 direct projects on housing, and as Ruth was just saying, they relate to housing codes, structural design issues, as well as energy issues. And so there's a lot of opportunity, and in a few minutes, Lisa will be talking about real strong opportunity points. The only other thing I'll say about this section of the manual is that, as Ruth was just saying, the locations started off heavily on the West Coast, but they have been really growing over the last few years nationwide. And so anybody that's incorporating housing into their housing HIA into their work now should feel like they're not alone. That this is a growing area, and that you will be able to find support in your region from others who have been doing this type of work. I think that when you're starting off, the question is, what is really the value to doing an HIA? And we tried to discuss this in the second chapter of the document. And there are a couple of, or at least 4 areas where you can see value. One for Hauser is issues with tenant turnover. There have been a couple of recent studies that have indicated that residents, especially older residents, may have health improvements after their homes have been renovated using green construction techniques. Healthier residents are then more likely to stay in their homes and not move out, which benefits the Hauser by decreasing the administrative and other costs for turnover. There's also benefits that have been shown. There was an HIA from San Francisco that looked at carpeting and the impact on residents with asthma. And it documented the benefits of actually having smooth and cleanable flooring as opposed to those carpets, which are another turnover benefit because you're not replacing carpeting on every turnover. So there are multiple benefits in this area. Beyond those turnover benefits, there's just general cost savings for having a healthier building. Recognize that one intersection of housing quality is with energy savings. Often when we do energy conservation work, we're tightening up our buildings so that there's less likely to be moisture infiltration, that pests are less likely to get into housing, and that there's better ventilation with that energy work. All these things improve the indoor environmental quality, and that relates to a better environment for the residents. And it's also those cost savings from the energy conservation come back to the pocketbook of the property owner. So we're seeing quality benefits and value in doing this energy efficiency plus health work. We also see for society that by working on these issues, that there are savings for the healthcare sector. We know that with the Affordable Care Act, that the healthcare sector is deeply interested in this. There are now penalties for when people are returning to the emergency department because of conditions such as asthma. And if we can reduce the triggers within the home that are causing these frequent visits, the healthcare sector is advantaged as well. So there are opportunities. I know many housing groups are looking to reach out to the healthcare providers and payers to see where those interconnections can be made and where there can be partnerships that can have savings. So the process of the HIA can actually bring together housing organizations, hospitals, accountable care organizations, and public health practitioners to look at the collective impact of their work. And these partnerships can have a great impact on gaining benefit to promoting housing work as well as public health work within communities. Finally, the built environment offers an opportunity for professionals from multiple fields to get together and talk about their priorities, talk about their commonalities, and build support for their programs. So we've seen a lot in the past with the health and all policies activities that we bring together people from public health, healthcare, housing, transportation, education, general human services, early child care, as well as community development finance to recognize that they all have commonalities within their work and that they really do need to work together to create a healthier and more vibrant community in their neighborhoods. So this is an opportunity point for everybody to reach out together. So with that framework, I'm going to turn it over to Lisa to talk about where within housing world in general there is opportunity to think about where you might have do an HIA with your work.
Great, thanks, Jonathan. And I'm going to turn it over to our speakers in just a minute who are going to talk about how HIAs have been used in real life experience in housing programs on the ground. So we'll be able to hear how HIAs have been used in action, but I wanted to provide some general thoughts about how the housing profession, how the housing community can think about how a health impact assessment might work in particular housing programs. In fact, when we started this work with the National Center for Healthy Housing, one of the things that we wanted to emphasize is to increase the understanding about where the decision points were, where the decision-making points were in housing programs where you might think about introducing an HIA, because too often the process is either confusing or unknown or a set, and you don't know where to start having the conversation. And so as part of the resources that will be available in the coming year, we really wanted people to be able to understand where there were these opportunities. And there were some places that really seemed to make sense. The first is when you think about the low-income housing tax credit program, HIAs have actually been used fairly relatively often in the planning, siting, and design of projects financed with tax credits. But there may also be opportunities to introduce an HIA in the state QAP process to better recognize how decisions about how tax credits are allocated to certain projects can influence the health of the residents of those projects. And so as the QAP process is being developed at the state level, there's an opportunity to think about introducing an evaluation of health impacts at that point as well. Secondly, housing gets built at the local level. There's a lot of federal programs that support the development and preservation of affordable housing, but at the end of the day, the decisions about where housing gets built really happens at the local zoning commission, at the local planning board. And so introducing a health impact assessment into the project approval process, frankly a process where lots of different evaluations are required, is also another way that people working on local housing issues can think about introducing HIAs into housing decisions. Decisions about preferences in the Housing Choice Voucher Program is another area in which health impact assessments may be introduced. For example, localities may set preferences regarding housing choice vouchers, who receives priority on waiting lists. Understanding those decisions in a health context can help make them more defensible, can help make them be more broadly accepted. And so when the policies around preferences are made, there's also an opportunity then for thinking about introducing an HIA. The biggest opportunity in the public housing program right now is the Rental Assistance Demonstration, or the RAD program, which many of you are familiar with. Decisions under RAD about the redevelopment of public housing, about the movement of residents during the redevelopment process, and other program elements, as they're being designed, can really be strengthened by including an evaluation of the potential health impacts by using an HIA. Finally, one area, and Jonathan mentioned this, where HIAs have been used, I think maybe to the greatest extent, has been in code enforcement policies. And so we've seen local jurisdictions that have, say, moved from a reactive to a proactive code enforcement policy really think through that program design by having information from a health impact assessment to better understand what the effects would be of moving, changing some of the policies around code enforcement. So as you can see, there's a variety of different housing programs and policies, from federal programs down to local policies, where an HIA could be introduced. And I'm going to turn it over right now to hear some specifics from folks who are working in the field and who have used HIAs. I will remind you that we want your questions, and so as you think of questions, as you hear from our speakers, please type them into the question box and I'll monitor them. And but for now, I'm going to turn it over to Holly Holston, who will talk about an example of using an HIA in the state of Ohio. So Holly?
All right, can you hear me?
Yes.
Okay. Well, thank you very much for having me today. Go ahead and flip to the next slide. Okay. So today I'm going to briefly go over the HIA we conducted and finished about a year ago. It was in partnership with Ohio State University College of Public Health, and we worked with Dr. Klein over there. And my agency led the HIA. Other folks involved included the White House Domestic Policy Council, the Rental Policy Working Group, and it was the subgroup charged with the alignment process, with the alignment of physical inspections. We also involved HUD, both on the state level and federal level, and rural development. We worked with the Coalition on Homelessness and Housing in Ohio, and that group is the large advocacy group, tenant advocacy group here in Ohio. And then lastly, we involved other state agencies, including Aging, Mental Health and Addiction Services, and the Department of Health. Next slide. So what did we do? We were looking at a proposed policy that has actually been under consideration for quite a while that would align physical inspection policies between HUD, rural development, and the housing finance agencies. So, for example, right now everyone does their own inspection, and the idea was to reduce the number of inspections and share the inspection results with all of the other agencies because the financing is layered, so it just makes sense. But what we wanted to do is really look at the health impacts of this proposed reduction of physical inspections and the associated changes in housing quality. So what would happen if this alignment policy was adopted nationally? What would this mean for housing quality? So as I said, the proposal was under consideration. It started in July of 2010. And the pilot project is ongoing, and more states have joined this pilot project, but there hasn't been an overarching policy nationally yet. And the key health concerns that we examined included asthma, respiratory symptoms, chronic disease, poisoning, and injuries. And there's a lot more information in our report, which is available on our website if you're interested. Next slide, please. So the recommendations, there were 3 big recommendations at the end of the day. The first one was to implement a single standard across agencies, a single physical inspection standard across the agencies that would be most likely to find health-related quality and safety problems. What we found, every agency, while using some of the same standards, the way the information was collected was very different. And it differed in the quality of the answers available, and it was really hard to get a sense of some of the magnitude of the issues as well. So we suggested that if we were going to align the inspections, there had to be a single inspection standard form related to that. The second recommendation was to establish ongoing training to increase the quality of physical inspection reports among all of the agencies, but also within that training raise awareness of the housing-related health issues. As we proceeded with the HIA, it was made clear to us that some of the other housing agencies, HUD and rural development, the staff didn't necessarily have the background on why the connection between health and housing. So we really wanted to elevate that a bit. And then the third recommendation was to start thinking about some sort of risk-based inspection agenda that focuses on resources, that would streamline the inspection schedule, and it could be based on both the housing and tenant characteristics. One of the most consistent findings we found in the HIA was that the age of the housing mattered tremendously, and so did the size of the housing project. So the more units or the older the project, more health-related housing quality issues were prevalent. Additionally, we considered every tenant vulnerable because they are all low income, but we also looked at children and then older adults as well. So there may be some additional protections that could be put in place for the most vulnerable groups. Next slide, please. So the impact, what's going on right now? So there's still what OFA is doing. So this isn't a national impact, but within our agency itself, we are testing and evaluating a new inspection system. It would actually be on a tablet instead of the paper system that we currently have now. We are looking at our inspection policies and how we identify projects at risk or those that possibly could have financial issues, which would then lead to housing quality issues down the line. We're rethinking our allocation policies using a health lens, really we're testing out looking at areas of opportunity, which actually includes some health measures in that for just one pool in our qualified allocation plan in 2016 and 2017. And then we continue to work with the Rental Policy Working Group on the physical inspection alignment. Like I said, the pilot project is ongoing. We are working with them, and we're trying to work through some of the regulations between all of the agencies. So it's taking a long time, but we're state government, but there are some small changes that have resulted from the HIA. Thank you.
Great, Holly. Thank you very much. I think that gives us a great example to get us started on some of the process involved, some of the stakeholders who have to be engaged. Again, for the folks on the phone, if you have questions for any of our speakers, please, we're getting some in, please enter them into the question box. I'm going to turn it over now to our next speaker, to Megan Weir from the San Francisco Department of Public Health, who is going to talk a little bit about their use of HIAs in San Francisco. Megan?
Thank you so much. It's really great to be on the call today. And can you hear me okay?
Yes.
Wonderful. So I'm going to be talking about an HIA that was actually one of our first forays into the world of health impact assessments that I hope will be helpful for those on the call that may be thinking about taking some of the first steps with respect to HIA practice. And as I said, this was one of our team's first HIAs and was in response to community concerns, and also really helped us build our relationships with the planning department. Next slide. So a brief overview, the policy decision really focused on the demolition and redevelopment of 360 rent-controlled apartments. So the building would be demolished and converted into 1,400 market-rate condominiums. And residents were really concerned about the potential human and health impacts. So our health department conducted an HIA that was more, more of a focused desktop HIA that also included some focus groups. We conducted a review of the empirical literature and also did some qualitative research with the tenants facing eviction and found health impacts of housing affordability and residential displacement, including the impacts of stress, crowding and substandard living conditions, food insecurity and hunger associated with increased rent costs, and also the loss of social cohesion associated with displacement. And we provided the HIA as a comment on the scope of an environmental impact assessment to the San Francisco Planning Department. Next slide. So the key recommendations resulting from the HIA as well as the advocacy by the existing residents was that an analysis of the impacts of residential displacement and the indirect impacts on human health would be required as a part of the project's environmental impact assessment unless the developer mitigated with a revised plan. Next slide. So the outcomes of this project were in response to the HIA along with the project opposition, the developer ultimately revised the proposal to keep the 360 units rent controlled with lifetime leases for existing tenants. The health analysis wasn't ultimately required in the EIA as a result of that change, but we also had longer-term impacts on subsequent projects that were informed by this, provided replacement of affordable housing in new development. As I mentioned, this is one of our initial HIAs over a decade ago, and I think it really helped increase awareness of the health impacts of housing among both community residents and decision makers, as well as by our other partner agencies in the city. And in years since, we've conducted some more comprehensive HIAs on public housing projects at the request of our mayor's office, and also are conducting a current HIA on single-room occupancy hotels that was requested through a resolution from our Health Commission, and those are also available on our website. And that concludes my presentation.
Great, thank you very much. I think it's a great example of how HIAs can really build awareness of the relationship between health and housing, and a great example of a project-specific application of HIAs. I'm going to turn it now to Shana Burkett, who's going to talk about an example from Denver. So Shana?
Hi, thank you for having me. Can you hear me?
Yes.
Okay, great.
So in 2009, Denver Housing Authority attempted to address the concentrated poverty and physical distress that was plaguing our South Lincoln Homes neighborhood while planning the neighborhood's redevelopment. Next slide. Our built environment is a direct determinant of health outcomes, which ultimately influence the quality and the length of life. DHA's approach was to develop a master plan to guide the South Lincoln Mariposa neighborhood redevelopment. So our approach was to maintain a practical balance between all of the surrounding elements, transportation, land use, recreation, housing, while also integrating health into every aspect of the planning and implementation. Next slide. So how did we do this? Through lots of community outreach and engagement in 2009 and 2010. There were over 140 community meetings or group interviews to review the goals, the concerns, concept options, and site amenities for the master plan. We also had 12 steering committee meetings in those 2 years to review comments within the community, to troubleshoot, and to offer further guidance to our master planning process. In total, there were over 550 comments received, and each of these comments received were used to shape the goals and the design of the plan and the community amenities and the location of the community spaces and the ideal phasing concepts. Okay, next slide. So the needs that we heard from the community helped to guide the master planning process. The community outreach identified the needs to ensure that there was a holistic sustainability for a livable community. How could the redevelopment incorporate all of those elements I mentioned before, transportation, housing, community development? DHA started with a health impact assessment to identify what was the baseline of these issues. Our HIA included available community demographics, socioeconomic information, along with our resident interviews and the surveys that were conducted. Our overlying goals of the HIA were to identify potential impacts that the redevelopment may have on the health and well-being of the South Lincoln neighborhood, to suggest ways to improve the overall health through evidence-based health data, and to assess any potential human health risks. Health issues were identified and recommendations were made to enhance the social and mental well-being, natural environment, built environment, transportation, access, and safety. Next slide. In regards to addressing these findings, the Health Development Measurement Tool checklist was used as a framework for this health impact assessment, and it was used to take the recommendations from the HIA and to create specific campaigns for action that would have specific strategies, actions, and the identified groups assigned to them so that successful implementation could happen. The HIA results identified the following health objectives that are seen on this slide as a baseline for the needs to be outlined for the residents. So we found different things like increasing physical activity. 55% of our community was obese or overweight. That we needed better access to health care, reduce crime, and increase opportunity for healthy eating are just a couple of those. The next slide. So the HIA ensured an emphasis on healthy development throughout the whole entire master planning process. Some examples of built environments that was done is that we have an active streets were designed. So the 10th Avenue Promenade with non-residential uses was designed this way. So it has wider sidewalks and wider areas for community gatherings. Designated bike routes to our nearby trails were designed. Daylighting was used to encourage use of stairwells, and this is where there's large windows that bring in natural light so that residents are encouraged to use the stairs instead of elevators. Each of our phases has bike parking and bike repair stations in each building. Community gardens and art pieces were also included in every phase. And then in 2 of our phases, we had something new, which was an active staircase, which these were staircases that involved music, lights, and like reading the story as you go up the staircase to also encourage physical activity and deter people from using the elevators. Next slide. So as a result of our HIA and the HDMT results, The master plan then adopted the Healthy Living Initiative. The Healthy Living Initiative offered the opportunity to provide tangible results by implementing programs and services for the neighborhood to address health, education, and behavior changes. As part of this Healthy Living Initiative, we brought on a Healthy Living Program Coordinator and a Patient Navigator in 2012, and their roles were to implement healthy living programming with a specific, they specifically were looking to implement programs that address preventative care, health education, food nutrition, youth initiatives, wellness programming, and physical activity. And I'm not going to read through all of these, but these are just some of the results we've seen. But as of 2014, we've had almost 500 residents served through the Healthy Living programming and our Patient Navigator. And that concludes my presentation.
Thank you very much, Shana. I think so. We've heard some great examples from work being done on the ground. I'm going to turn it back over to Ruth, who's going to talk about how to get started. As you listen to these being done, what do you need to know to get started to do an HIA in your community?
Great, thanks, Lisa, and thanks to all of the speakers for those great examples. So we know we've covered a lot of information in our time together today, and so for those of you who may be brand new to HIA, you may be wondering where you would even begin if you are interested in learning more or applying HIA to your own work. So we thought we'd wrap up here today by providing a few simple steps that we can suggest for you to consider to get started in including health or HIA in your work. So one thing you could do is to start screening upcoming decisions in your organization or in your community to identify a housing decision where HIA could add valuable health information. As we've discussed today, proposed policies, plans, and actions around public housing programs, housing choice voucher programs, low-income housing tax credits, code enforcement and inspection policies, redevelopment and zoning decisions may all be ripe for applying HIA to. If you're not yet connected to local public health practitioners in your community, you can start by identifying a willing partner who might be interested in collaborating on an HIA with you. So state and local public health departments, public health institutes, community-based public health organizations, and schools of public health at your local colleges and universities can be great places to start to make those connections. Even if you're not quite ready to embark on an HIA, you can start to think about the connections between your work and health by using existing data sources to examine a project or policy's potential connections to health and to identify some of the most prevalent public health issues that are affecting the communities that you work in. For example, if you're working on a redevelopment of an affordable housing property, you could start by using existing data to identify some of the pressing health issues that might be facing residents in the neighborhood, or consult with public health experts to consider how you can use that redevelopment as an opportunity to promote health. If you identify an upcoming decision where you think HIA would add value, you can start by determining what your organizational resources are. What funding and staff time might you have to contribute? Are those available to conduct an HIA in a time frame that allows you to inform the decision-making process? And you can also begin to gather stakeholders with an interest in the decision or an interest in health. There are many available HIA tools that you can look over and use as resources to get started and learn more about HIA. These are just a couple of examples of data sources and resources, but there are many more available through a couple of websites that I'll hit on in a bit. I'd also like to draw your attention to a couple of forthcoming products that you've heard people reference throughout the webinar today that the Health Impact Project, the National Center for Healthy Housing, and the National Housing Conference have been partnering on developing. We're working on a technical guidance document on applying HIAs to housing decisions, and you heard Jonathan talk about some of the segments of that manual, as well as 2 associated policy briefs, one for housing professionals and one for public health professionals. And we look forward to sharing those resources with you when they are finalized in the coming months. You can also reach out to national HIA experts and organizations that work to support HIA practitioners to get advice about how to get started. So one resource in particular that I will draw your attention to is the Society of Practitioners of Health Impact Assessment, also known as SOPHIA, which serves as a national membership organization for HIA practitioners and creates many useful resources. This can be a great starting point for people to learn more about HIA, and they are linked to several other national organizations that have tools and resources on their websites. Finally, you can consider attending training to learn more about HIA. Georgia Tech has a list of HIA training opportunities available, and there's a free online course available from the American Planning Association and the National Association of County and City Health Officials. There's also a national HIA meeting coming up in June of this year, where there will be an HIA 101 track for those who are interested in really just learning the basics of HIA, as well as several presentations throughout the meeting on the housing-related HIAs. So I can encourage folks to consider attending that. And finally, I just want to thank all of the funders and the organizations who've contributed to this work and helped to make the webinar possible. I would like to draw your attention to our contact information here. If you have questions, feel free to reach out to us at the Health Impact Project. And wanted to note that on our website, when Jonathan was talking about the resources and growing capacity in different states, on the Health Impact Project website there is a map of all of the HIAs that we know of that have been conducted or are in progress across the country. And you can use that and sort it by the housing decision level or the sector type. And it's also a great place to start learning about the folks that are doing HIA work in your community. So I suggest folks take a look at that resource if you're interested in connecting with HIA practitioners in your community. So with that, I'll turn it back over to Lisa, who's going to moderate the answer portion.
Great. Thank you, Ruth. And thanks to everyone on the call for your questions. I want to start with a question, and Ruth, you touched a little bit on resources, and I'd like to pose this question to Holly and to Megan and to Shana about where localities could find, or states or localities could find resources to engage in an HIA, and whether there's what kind of trade-offs are made between using in-house expertise and in-house staff, or whether HIAs are done by contracting this work out to somebody. Holly, I wondered if I could start with you. From your perspective, where would one go to find resources to do an HIA? How much did you rely on in-house resources versus contracting with folks outside of your agency?
Well, we didn't contract with anyone. The Office of Research, which is my office here at the Ohio Housing Finance Agency, ran the HIA in partnership with the College of Public Health, and we've had great partnerships with OSU in the past. As far as expertise, here in Columbus, we have a lot of resources. I mean, in the state of Ohio in general, but locally we had, Columbus Public Health that had done some HIAs and had been involved in this, and then Cincinnati, and then obviously Cleveland are very much involved in HIAs. So we did everything ourselves, and it wasn't even a thought to contract out the work.
So Megan and Shana, do you all have any experience with working with outside organizations, folks outside your own group on an HIA?
Hi, this is Megan. Go ahead.
Go ahead, Megan.
Sorry.
Okay. So we have also made it a priority to develop our health department staff capacity to conduct HIA, and that was the example I shared was really some of the beginnings of that work. So we do have also experience in partnering with like University of California, Berkeley, on some of the methods development for HIA and other types of analysis, and also since we started our work in HIA, we're really fortunate to now be in a climate where there are a lot of opportunities for grant funding to bring on additional staff to focus on HIA, so we've also pursued those avenues.
Great. Shana?
Yeah, I was just going to say our master planning team that we contracted with really helped develop the HIA and get it implemented. We did have internal staff that helped with the process of gathering the surveys and resident information, hit the pavement and got that information from our actual residents, but it was the firm that we had contracted with that really spearheaded it.
Great. Another question for our folks working in the field, and maybe Shana, I'll start with you because your presentation really highlighted this. One of the key parts of an HIA is really this community engagement piece. We heard a lot about that from Jonathan and from Ruth, and in your experience, what advice would you have for making community engagement a real informative and productive part of the HIA process, and in the example that you talked about?
It has to be. I think that was one of the major factors as to why we've been so successful is what we've implemented is what the residents asked for. granted, we took some of the health data that was gathered and came up with programs around that, but everything that was put into place was really what residents asked for at the meetings or through the surveys. And you talk about community engagement. One of the things that came out of a lot of our meetings that we had was that residents really were connected to this neighborhood, and the disruption of displacing them during redevelopment really was something that they've always concerned over. And so we did this development in a phased approach so that residents who wanted to stay on site could stay on site. Some residents weren't connected, so they were fine with leaving. So if those residents were identified, we would have the residents that wanted to stay on site move into those units. So they were a part of the entire process instead of displacing them, and then we didn't have our community in the community to help guide us with everything.
That's great. Megan, do you have any comments on how community engagement worked in your process, or what advice you might have for folks looking to have good community engagement?
Sure. I mean, I can, community engagement is also a really core to our program, really being responsive to the health concerns of community. As with this HIA example, I think for people that are interested in, taking on an HIA for the first time, really starting with what are the concerns that you're hearing in your community around housing issues that may not be explicitly identified as a health concern, but through the process of a HIA could really be explored better to inform more health protective policy. And also really keeping in mind that I think kind of unexpectedly a benefit of HIA when done in the way that I think a lot of these examples shared is just kind of building local capacity for more engagement with community around these issues as well. So it is really an opportunity for all partners.
Holly, yeah, please, Ruth, do you
think I can add a resource for folks on that line too, that there's a guide for best practices for stakeholder engagement in HIA that I suggest folks that are interested in learning more on that front to look at that. And if you have trouble finding that resource, feel free to email me at the contact on the screen.
Great. Holly, do you have anything that you would like to add around community engagement?
Well, ours is a little bit different. We, in order to reach out to tenants and our property managers, we interviewed them, so it wasn't the same community engagement that the other two presenters discussed, but it was just a function of the policy that we were looking at. It was more of a federal and state policy, so we had a different type of engagement. But we did reach out to everyone, including tenants.
Great, thanks for that. So, Jonathan, I have a question for you. I have a couple of questions here about the use of HIAs with particular housing policies and programs. So, the extent that you've reviewed some examples of where HIAs have been used, we have a question about whether, and I can help think through this too, whether and how HIA could be used in policies related to zoning changes, particularly inclusionary zoning, where the character of the neighborhood has important health implications, and also whether HIAs have been used in eviction policy changes. Do you have any direction you can point us in on those two areas specifically?
I'm going to trying to think of, I know there's been work around rental policies, and I'm trying to think back if there has been one on eviction policies. There's definitely been one around vouchers and the proper way of handling those and issues with the length of time that people have vouchers and that kind of structure. But I'm sitting around a table with people shaking their head thinking that eviction policy has not been one that we have run across. So that seems right for work, and I would encourage you to look into that. Inclusionary zoning has been an issue in housing policy for a long time. And again, I don't recall anything that was strictly about that. There's definitely been some work about zoning policies, but inclusionary zoning, other than the fact that an outcome of some of the HIAs was to think that inclusionary zoning should be part of the outcome.
Yeah.
Lisa?
Yeah, I'll just say one thing on inclusionary housing, then maybe pick back up on the eviction issue. I think, one of the things that we're learning in inclusionary zoning policy across the country is that there's options for folks under inclusionary zoning. So inclusionary zoning can require that affordable units be built in the same locations that the market rate units are, or a developer can achieve compliance with the requirement by paying into a fund, which would then put the unit somewhere else. And it seems to me that that choice of offering an in lieu fee versus an on-site requirement could be potentially evaluated in a health context, right? Because you could imagine that the location of where those affordable units ended up under the various scenarios would be different, depending on which way they went. So, I don't know of anyone who's looked at it that way, but it seems to me that as we're learning more and more, and there are over 500 localities with inclusionary housing programs now, and they're doing them in lots of different ways, that there are opportunities there. On the eviction issue, I had a specific question, and Megan, I wonder if maybe you had something you could weigh in on this. I had a specific question about the Ellis Act, which is eviction related in San Francisco. I wondered if you could describe the Ellis Act and help us think through whether HIAs are relevant in that context.
Oh, I'm sorry. I so wish I could. I have to admit that I'm not prepared to speak on that. I apologize.
No, fair enough. And you were our California person, so that's why I put it on you. For the person on the call who answered that question, it may be something that we can look into, and we can find out where we might be able to provide some information around that. On the California theme, though, we have another question about in California that the fact that there are regional housing needs assessments, which are a requirement for allocating affordable housing throughout a region. And so the question is, whether there are other states that have a similar allocation process, and I would argue that California is unique in many ways around that. But this larger question of whether there are opportunities for thinking about an HIA in a local housing needs analysis, right, or a regional housing needs analysis. And Jonathan, I'm looking at you again. I don't know if this is an area that folks have been looking at in terms of HIAs.
I do know that we've seen, so there are a number of HIAs that have been done in California around the housing element. And so it's definitely true that when we see 16 HIAs in the past 15 years done in California, a number of them involved that zoning element and that planning element. We saw one housing element discussion from Oregon that I recall, and so I don't know if it's a formal part of their process or whether they saw their neighbor using this and they decided to incorporate it into their process as well. I have not seen any other parts of the country that have gone in this direction. And from my housing background, and again, I looked at Lisa too, because you've been doing a lot of research around this as well, I have not seen this elsewhere other than the West Coast.
Yeah. Ruth?
No, I would just say that I'm happy to share with folks, and this will be one of the pieces of the guidance coming out, but if there are specific questions on the 40 HIAs that NCHH reviewed as part of this work, and folks sort of want to dive into that literature base, we're happy to share that list and point you in the direction of those resources.
So just to make sure, our other panelists, Shana and Holly, Megan, do you all have anything you want to weigh in on in terms of local or regional housing needs analysis?
This is Megan. I mean, I think, with respect to where, at a regional level, with respect to where housing is planned and developed has a whole range of, potential health impacts that I think we can all imagine, that are very valuable, I think, to consider with respect to these larger issues and whether or not we're, promoting housing development near transit, et cetera. So I mean, I think it's a really spot-on question.
And I would actually follow up on Holly's point. There's actually a really good HIA that was done in St. Paul and in Minneapolis that looked at the Green Line light rail that was going between the two cities. And that sort of connects up with the question of inclusionary zoning, which is that a lot of the discussion was around access to the public transit, what the impact was going to be on businesses along that route, walkability. But a key component of that, and what came out as the highest priority, was the issue of affordable housing and whether there needed to be different zoning changes to make sure that this public resource that was being put in was not going to displace affordable housing units along this line. And so I thought that was the most interesting part of that, is that was the number one recommendation that came out of it.
So we have another question, which I'll try and summarize. We talked a lot about the importance of engaging the community. There's also this trade-off, it seems to me, and maybe this question's getting at it a little bit, of how much time there is between the proposal of a policy and implementation of a program, and by introducing a new study and introducing this level of community engagement, how important is it to ensure that folks aren't displaced at this time in which this conversation is ongoing? And so, I'm looking at Ruth, I'm looking at Jonathan. If you could comment on this sort of timing of this and the importance of thinking about the people who are actually affected by the policy or program themselves.
Yeah, I think that's a great question. And as I said at the beginning, HIA is not going to be the right fit for every decision. And I think as the field of HIA has grown, we have seen organizations start to think about sort of adapt the core elements of the HIA framework into more simplified methods or health and all policies approaches to bring health to the conversation, but perhaps without going through a full HIA process. I think Megan can probably speak to their experience in San Francisco, where their work on HIA and pioneering in that space led to just sustainable relationships with different agencies, such that the health department is really at the table in a lot of decisions that are happening locally. And maybe there's not a full-blown HIA for every piece, but there's some aspect of weaving in health data, health expertise, community input. And so I think HIA is really meant to be a flexible tool and to be able to be adapted to different contexts. And so you'll have to figure out, depending on the time frame that you have for that decision, what is right for you and sort of what scale and what scope of an HIA.
This is Megan. I just thank you for referencing our work, and I just wanted to follow up with saying, yeah, as our HIA practice has grown, we definitely have come to see it as a really valuable and important tool, but not the best tool for every scenario. So taking that health and all policies approach, building relationships with both community as well as agency partners, so that we can help inform policy decisions from a health lens, but being also responsive, as I think the question got to the point. HIA, when done in a kind of a full-blown HIA, is definitely does have time and resource issues that might not fit every issue, and providing input in a different way can definitely be a better fit in some cases.
I guess I would add 2 points. One on the San Francisco discussion, that one of the real interesting articles that I read was a follow-up to this Trinity Plaza case, and it was not about the outcomes as much as the process, and it talked about how the health department and the planning department really found value afterwards. So I thought that was a great article and really informative. The other part is that as we talk about the steps of an HIA, that often you may have an issue that the research has been done in other settings. And so instead of having to do a new lit review or a new process up front, a lot of that you can take, and then I find the stakeholder engagement often being the most valuable, is just not ignoring that and evaluating how important that is to the planning process and the decision-making process.
Shana and Holly, did you want to add anything about the appropriateness of using HIAs in different contexts or the timing of the study itself?
I would just contribute that I agree with the comments that it's not always the best procedure for every event, but in our case, we did a rapid one. We had to do ours in 4 months, and just really relying on the data that is already out there that's been collected, as well as having the right people at the table, and then that incorporated with the resident feedback can enable you to get the same results, getting that health data to look at it with that perspective.
Great. Great. Well, that's all the questions that we have. So I want to thank the participants of the webinar for your great questions. And I definitely want to thank the panelists from the National Center for Healthy Housing, from the Health Impact Project, and our panelists from the Ohio Housing Finance Agency, the Denver Housing Agency, and the San Francisco Department of Public Health. You have resources up here that I hope that you'll make use of as you think of other questions related to health impact assessments and how they might be used to make better decisions about housing to really expand opportunities for housing to more and more members of the community. As I mentioned at the beginning of the webinar, the recorded webinar along with the PowerPoint will be available online, and you should be getting an email in the next couple of days with access to that information. In the future, I hope you'll check out the websites of all the organizations that have been on the webinar. There's lots of good resources around housing and health issues, and we look forward to staying engaged with you on all these issues. So that's it, and have a good afternoon.